Yes. Thank you very much, Mr. Chairman, colleagues on dais, and distinguished audience, delegates. Can't hear me? All right. I did not have intention of sharing a slideshow with you, but I thought maybe it may be worthwhile just setting a few questions and then try and answer them through Q&A. Now, excuse me. Hello. Busy. This one. ये साइड में क्या क्या हुआ है? It's coming there. You don't have the full screen. Okay, there are two fundamental issues which we have to address. One, okay, come along. Many people has talked about healthy people that make healthy nation, and therefore health of the population must be an integral part of public policy for social and economic development of the society. We've been talking about this, and we know there's so much of statistics available in these forums and also in the net, that the public spending on healthcare is just about 19% of the total healthcare spending. And out of the remaining 80%, almost 10% comes from insurance and 70% is out of pocket. So we've known this for a long time, and there have been so many debates going on to find solutions. And one of the solutions that we are working out on in Kashmir is essentially to create across the state PPP models where we have private sector coming and managing and operating district healthcare delivery networks, and also establishing super specialty hospitals across the state. So these initiatives are already on, and I would like to share some of the issues that we have addressed, that healthcare spending in a country depends largely on national economy, and however the manner in which these funds are collected, allocated and utilized depends largely on public policy. And we have emphasized in two states, one in Kashmir and one in NCT, that public policy must drive the growth of the health sector. And how do we incentivize investment? So consequently, the extent to which healthcare services are deployed, distributed and accessed also is influenced by public policy. Therefore, many progressive nations have used public policy initiatives to incentivize financing and provision of healthcare. Now, sectoral reforms in India have been formally initiated a long time ago, have not been initiated. However, universal access to basic healthcare has remained the significant part of social agenda and political mandate since independence. In this endeavor, public health measures for promotion of health and prevention of disease and disability and universal access to primary care, including maternal and child health, have remained the basis of public spending. So, if Health for All by 2000, the National Rural Health Mission, and now Rashtriya Swasthya Bima Yojana, and now the National Urban Health Mission are significant public policy initiatives that promise a major impact on health status of a sizable and vulnerable segment of our society living below poverty line, especially in the rural areas and semi-urban areas, by providing universal and equitable access to basic health services and continuum of care. Now, government is the largest provider of health care in the country, especially at the primary and secondary levels. Government is also the largest buyer of healthcare services at the tertiary and quaternary care levels. While 60% of healthcare infrastructure is in public sector, nearly 80% of the healthcare expenditure is made through private sector. Now, private sector investment in healthcare have been driven by free market economy, and therefore the cost of healthcare largely influenced by investment cost and the demand from the economic segments of society with ability and willingness to pay for such services. Every corporate investment has been based on these fundamentals, and therefore these services have virtually remained out of reach of a large majority of our population due to cost consideration and inability to pay for such services. Now, what was envisioned? We have many documents to project the national policy for healthcare. What has been achieved so far? There is a very big gap between need and availability, both infrastructure, capacity building for human resource, and likewise, including IT. What are the impediments that we are facing? Is it only the money? Is it skill set? Is it logistics? What are the impediments that are holding us back to launch a major drive of strengthening healthcare infrastructure? And what are the achievable targets? Have we set them out for next 10 years? And what are the plausible solutions? Now, let's debate and resolve these issues. And there cannot be a better forum than this to think about it. So my objective of this presentation was only to provoke ideas as to where do we want to go and how do we want to go. With these words, I'd like to sit down and try and answer any question that you pose with the permission of the chair. Thank you.